This is a case of a patient who has been operated in childhood for a medulloblastoma, and those images are the control images post-operation, sometime after operation, when the patient was 19 years old. We can see the atrophy in the cerebellum, the area where the tumor was resected. This is T1 after contrast that shows no enhancement, no signs of recidive tumor and normal ventricle system. Now the patient at the age of 33 presented with walking disturbances for control study that is showing exactly the same situation in the posterior fossa after operation, and the atrophy in the cerebellum after radiotherapy. No signs of contrast enhancement, but we discovered a lesion in the mesencephalon on the left side at the base of the left cerebral peduncle. When we look closer, we see that the lesion has low signal on peripheral parts on flare sequence, and on the T2 weighted sequence it shows the periphery low signal with a bubbly appearance, popcorn-like appearance inside, no perifocal edema, some parts of the structure enhanced with contrast. So our interpretation of the finding is that this is in fact a radiation-induced cavernous malformation, so post-radiation cavernoma. Interesting case, and something to look at. The age difference between this original old exam and current also suggests the period of development of such cavernomas. Okay, thanks for watching. If you like this type of interesting cases, you can consider subscribing, and you can certainly review my prior cases.